Okay, welcome back and good afternoon. Thanks everyone for joining me today for today's webinar on BioFlex Personal Therapy Systems for wrist and hand conditions. If you haven't joined me before for these webinars, I'm the Director of Education and Training at Meditech International. We are a medical device company. We manufacture the BioFlex family of laser therapy systems, and we distribute two different types of laser therapy equipment. One is for healthcare professionals, and the other stream is for at-home use for people to use at home. So I do two streams of webinars. One is for the home device, the personal therapy system. They're called the P180 or the P120. And I also do professional stream webinars as well. They're always free. And you're free to join in any webinar that you wish. Every webinar is recorded, then we edit it and we send out a follow-up email that has a link so you can watch it again, or if you're not able to actually join in, then you can watch it at your own discretion as well too. Just a couple of bits of housekeeping here. This is a Zoom webinar, not a Zoom meeting. In a Zoom webinar, you only see me, I cannot see you. I have complete control over everything, which is pretty awesome. So in a Zoom meeting, you may have had them before. You can chime in and do different things. Right now, all you can really do is listen to me. If you have any questions for me, specifically for during the webinar and about the webinar, then type them in as you go along in the Q&A box. Try not to do it in the chat function because then I have to go to two different kinds of things there. It's much easier if I just go to the Q&A box, and I'll be taking up the questions as we go along. So let's get started. I have about half an hour. Hopefully I can get through everything. The topic today is specifically on common conditions that you might use your personal therapy system for at home for pain or symptoms around your wrist and or your hand. I haven't covered every known condition, but more the common ones that you'll come across. And I do want to preface this by saying that you should always seek out a healthcare professional before you start to treat yourself, especially for a new condition or injury or what have you. That makes sense because you want to know what you're treating. You want to make sure that it's nothing serious, that you don't have a fracture or whatever it is. So you're better off doing that before you do anything else, right? So I'm just always recommend that you seek out professional care instead of using Dr. Google, which is not a real doctor. Okay, so let's carry on. I'm going to talk always a bit about the systems just so you understand what they're about, and then the effects of what's referred to as photobiomodulation. In other words, a photon of light, a biological system or bio, and modulation, meaning change, and of course, therapy. So the treatment is now referred to as photobiomodulation therapy, but most people refer to it as light therapy or phototherapy or laser therapy, cold laser therapy. There's many different terms for it that's been used. I'm going to talk briefly about the anatomy in the area, just so you guys have an understanding of what we're dealing with. And then I'll get into talking a little bit about the types of conditions that you might be suffering from, a little bit about what causes them and the symptoms associated with them. And this is a good idea because you know what, you may not be knowing what's going on, and this will trigger you to say, oh, okay, maybe I have this problem. And then of course, go out to a healthcare professional and get a good diagnosis or imaging or what have you. Then I'll talk a bit about actually using the equipment, where to place the light array or the pad, and some other tips about using the equipment as well. And finally, of course, I'll have time for a Q&A session at the end. So we actually manufacture and distribute two types of home care systems called the BioFlex 120 or P120 and the BioFlex 180. They're very similar, except that, of course, the size, the number of arrays, the number of diodes, and the power generated is slightly different, one being smaller than the other. And if you're not sure maybe what's best for you, that we, of course, have sales representatives that can go over that with you as well. So really the difference is being the number of diodes. So if you're a larger person or larger areas to treat, then of course the larger P180 would be more applicable. The treatment side of the array has what I refer to as bicolor superluminous diodes. It's a hybrid really between an LED or light emitting diode and a laser diode. It's quite a bit more powerful than your standard LED. They're made specifically for us by a Japanese firm, specifically for wavelengths that we use in photobiomodulation, red and near infrared. And also too, they're designed to be emitting 2 wavelengths out of 1 diode. Not at the same time, it's always red first, then infrared. So that's really the treatment piece that you're going to put on your body. So the controller unit looks something like this. I'm sure you're aware. It has little icons for the different locations of symptoms that you might be treating, starting from the face, so like the temporomandibular joint, and all the way to the ankle and the feet. Of course, today we're interested in the wrist and the hand. So when using the equipment, you're going to click on the wrist or the hand icon for treatment. You'll also see at the bottom portion different buttons as well, the power button, stop treatment, pause and start again button, and then selecting the stage. And the stage you can see is the far right, the blue little bars, 4 bars representing 4 different stages of intensity and stimulation. The number one thing you should understand about this type of therapy is that it's not in your face, I can feel it therapy. It's actually very, how should I say it? It's very gentle, and you may not feel really much of anything. And the more light that you have isn't necessarily going to provide better results. It's all about getting the correct dosage. And of course, Dr. Khan, who is the CEO and the founder of Meditech and these systems, has designed these parameters, these stages, based on his clinical insight over 3 decades of treating at our large clinic here in Toronto. So we've put in different types of pulses of light, of varying power and treatment times in order to gauge how you would, treat a condition. And I'll go over that at the end of today's webinar. The effects of photobiomodulation are quite varied, and it's quite interesting how it works. Of course, I'm not going to go into details today, but it can improve microcirculation, and that's really important for getting rid of waste products and metabolites that build up in a condition like arthritis or what have you, reducing edema or swelling, those kinds of things. It helps modulate collagen production, which is critical for scar tissue formation, reducing adhesions, those kinds of things. So that's also really important. It can modulate skeletal muscle regeneration and repair. Excuse me, it can have an impact on white blood cells and thereby helping control inflammation. And it can help nerves repair. I'm going to talk about carpal tunnel syndrome a little bit later today. Of course, that's in part a nerve problem, as well as cartilage and bone, which is more associated with degradation during arthritis. And I'll touch on that, of course, today as well. So photobiomodulation works 2 ways. One is directly, one is indirectly. Directly is when the light gets absorbed by cells and tissues that are inflamed or injured or diseased. And this direct effect of light can actually help improve the metabolism of these cells and therefore help these cells recover, or at least improve their ability to function. So this is called a direct effect. And this is where the light will be absorbed and you get the light directly to the problem. Now, sometimes you can't get the light directly to the issue, or the light's being absorbed in the blood, and that creates what's referred to as a systemic effect, or an effect that occurs sort of due to circulation. And really, this has to do with treating the blood and even the bone marrow. And by stimulating what is found in blood, specifically white blood cells, platelets, not so much red blood cells, but more so white blood cells and platelets. And it actually stimulates them to to modulate their production of anti-inflammatory chemicals or cytokines. We all have probably heard of the cytokine storm associated with COVID. And that's where the body reacts in a huge sort of systemic inflammatory response to the virus. And our body creates all these nasty inflammatory chemicals meant to fight the infection. But of course, it does it in such a high level that it can actually create difficulties for the body. And that's where people start to have all these serious problems. Light therapy does the opposite. It actually helps with, it actually helps reduce inflammation by causing the white blood cells to shift from inflammatory chemicals to anti-inflammatory chemicals. And believe it or not, there is some interesting research that's been done the last year on using photobiomodulation for the treatment of COVID symptoms and even conditions that we refer to as post-COVID syndrome, including neurological symptoms. If you're interested in that kind of application, we're doing a masterclass in a couple of weeks on June the 5th. One of the keynote speakers, Dr. Ashley Banjan, a neurologist from South Africa, who uses our equipment, and the last year and a half, he's been treating patients with neuro-COVID and post-COVID syndrome symptoms. So if you're interested in that, I'm not saying you can use this equipment for it. Well, it'll be off-label use. That'll be up to you. But if you're interested in learning about this, you can certainly join up for that day. It's a whole day event, and the details are on our website. A little bit about anatomy review. The wrist area has 2 rows of bones, each having 4. So there's 8 carpal bones or wrist bones in total. They articulate or join with the distal end of the ulna and the radius in the wrist. And they also articulate with the metacarpals, which are those long knuckle bones of the hand as well. And then from the metacarpals, you have the phalanges, and each one has 3, well, except for the thumb has 2. And these phalanges, of course, are our fingers. And you can see the blue areas, those are the articulations or the joints that articulate with all the different areas. So that's the osseous or the bony skeletal makeup of the wrist and the hand area. Lots of muscles. I'm not going to go through all the anatomy of the muscles, but they're layered in what are referred to as the flexors and the extensors. So when you clench your hand and feel your forearm or in your hand, you'll feel muscles contract. Those are all the flexor muscles. And on the back of your arm, when you extend your fingers, you will feel muscles contract, and those are the extensor muscles. And they're divided into superficial and deep or intermediate, depending on the area. Lots of long names, many of which I've probably forgotten, but even though I did teach anatomy for 10 years. But so if you're interested in more, then there's lots of resources, obviously, on the internet. One other point about anatomy I want to just mention is the carpal tunnel. The carpal tunnel in cross section looks something like this in the wrist bones. It's kind of curled or curved. You can see the curved area, and that houses all the flexor tendons that go to your wrist and your fingers. But it also houses a nerve called the median nerve. And on the very top portion, you can see a ligament. Now, this ligament is what keeps everything in place. It's a very firm, strong ligament. The problem is when you get inflammation in this sort of tunnel area, the inflammation compresses whatever's in there, including the median nerve. And the symptoms usually are numbness and tingling and different sensations in the hand and the wrist. I'll go over that a little bit later. But this is the area that we're concerned about when we refer to as a carpal tunnel syndrome. Lots of different causes of pain. I'm going to go into this a little bit more detail, from OA or osteoarthritis to arthritis. Systemic lupus erythematosus can also cause irritation of joints. Rheumatoid arthritis. There's a condition called pseudo-gout, and even gout itself. You can have other issues like de Quervain's tenosynovitis, which is a condition of tendons near the thumb. So lots of different conditions that potentially can cause pain and irritation in this area. So let's get started. Specifically, carpal tunnel syndrome. It is a fairly common one. Obviously, many people are using their wrists and their hands in a repetitive way on a computer or other workplace kinds of things that you might do. Most of the time it's idiopathic. The cause isn't necessarily known. It can be on both sides, so bilateral. And what happens is there hypertrophy or thickening of the membrane of the tendons caused by this connective tissue disorder. There's sometimes vascular issues, swelling, and even issues with collagen production as well. Computer use, generally speaking, the research has shown that you need to be doing something on a computer at least 15 hours a week in order for this condition to sort of crop up. I mean, that's what the research has shown. Of course, sometimes it does appear even using your hands less than that, but it is something where you're going to be doing repetitively for this to show up. There could be unusual anatomy called aberrant anatomy, congenitally small carpal tunnel syndrome, for example, or a ganglion cyst that can appear, or even lipoma. These can all put pressure on the carpal tunnel and cause irritation. I know some of you are asking questions. That's great. I will get to those questions at the very end. I do have a comment here. You have black boxes showing on the screen. I think you have comments on there, but we can't see them. Oh, I'm not sure what you mean by black boxes. I'm not really sure. Trauma, fractures, sprains, they can also cause swelling and volume lesions that are referred to as that. Okay, so someone says I'm sharing the screen wrong. Okay, well, let me check that out. Can anyone here comment else? Are they having issues with seeing I'm not sure what the issue is here. So let me just double check this because I'm getting one comment. Can everyone else let me know if they're seeing the screen okay? And in fact, they can see me. Let me just double check this. Okay, I do have comments about black boxes. I'm just trying to figure out what this is referring to. Oh, now I'm getting lots of comments. So let's hang on a second here, folks. You won't see them, but we do. Okay, so let me just see how I can rectify that. Oh, it seems to follow your mouse movement. I am sharing my desktop actually, so I'm not really sure why that's the case, but let me just double check the share function. Advanced computer portion of screen. Sorry, folks, you know what? I'm not seeing where I can actually alter that. What I'm going to do is not move my mouse around, so maybe that will help. Let me know, because I do have to continue on. Okay, so rarely infections can cause this as well too. That can also lead to what's referred to as a space-occupying lesion. So there's that. And inflammatory conditions, even rheumatoid arthritis, gouty conditions can also cause issues as well. And anything that increases the carpal tunnel canal volume. It's not uncommon in pregnancy, by the way. It's temporary, but you can get this during pregnancy or even obesity. Sometimes hypertension or even edema can cause this as well too. Rarely associated with conditions like diabetes and hypothyroidism as well. Some of the symptoms include sensory disturbances in a very specific area around your thumb and your first finger area. There can be weakness of clenching of your hand. There can be some atrophy or weakening of the thumb muscles around that area as well. That's more in advanced cases. You can get some obviously pain and throbbing in the area as well too. So wrist sprains, these are quite a common problem, usually caused by trauma when you're fallen. during a sporting event or just a regular fall with an outstretched hand. So this can happen obviously during regular everyday activities or what have you. They are graded from a grade 1, 2, and 3 from mild, moderate, or severe. And really it has to do with how much damage there is to the collagen and the ligament itself. Everything from a very mild stretching to a partially tear to complete tear of ligaments. I do suggest that anytime you have a fall and you've sprained what you think is sprained your wrist and it's quite painful, get an x-ray because it's not uncommon to have small fractures in your wrist without you even really thinking it's a fracture. I myself had that back as a teenager, thought it was a sprain. 2 years later, I had to have a graft surgery for a fractured bone. So it's not uncommon. So just make sure that you definitely take care of that. So obviously the symptoms include swelling. Obviously there's going to be pain, especially with certain movements. You might see bruising or discoloration. There's going to be tenderness when you palpate it or touch it. There may even be a weird popping sensation. You may feel warmth or fever-like feeling. That's due to the inflammation process as well. Fracture-wise, there's different types of wrist fractures. I'm not going to get to all the different types in detail, but I do want to mention one in particular. That's the one I had, the scaphoid fracture. It's a small little bone, lies sort of just underneath your thumb. And this one is commonly fractured. So the most commonly fractured one, a bone when you have an outstretched hand. And so if you know your anatomical snuff box, where you sort of bring your thumb up, I'm going to kind of show this in the picture here. You bring your thumb up right underneath your thumb, and you'll see a little kind of snuff box appear. If I can form it right there, okay? If you palpate and push in through there, that's where you'll feel pain with the scaphoid fracture. But again, if you've fallen and have suspect a sprain or anything, get it x-rayed, rule that out, because if you don't, this particular bone can be quite problematic. There's the bone there. You can see it just underneath the thumb. And you can see a sample here of a fracture. There's a little artery that passes through that area that when the fracture occurs, it can actually sever the artery. It sounds dramatic, but essentially what can happen is it can cut off blood supply to the bone and it doesn't heal. So that's where you have to have surgery to fix that problem. A condition that's quite common is has a funny name, de Quervain's tenosynovitis. Teno refers to tendon or tendon sheath. That's what the synovium is. So a tendon itself has a sheath around it, and it's inflammation of the sheath of the lining of a couple of tendons that sort of travel through your wrist and to your thumb. So if you extend your thumb backwards, so if I look at my clenched hand here, and if I extend it backwards, and you look at that anatomical snuff box, those are the tendons I'm referring to. There's a test you can do for it where you grasp your finger in your hand and an examiner pulls it down like so, or pulls it away actually, and you'll feel pain. You definitely feel pain along that area. That's called a Finkelstein's test, and that's usually a sign of it. But again, I would, like everyone, if you have pain in that area, to get it examined. So it increases pain with writing and doing, grasping, those kinds of things. And it's a fairly common condition, usually a repetitive strain injury. It seems to be a little bit more common in women than men. Peak prevalence is in the 40s and 50s. It's also common when you have issues around the elbow, so tennis elbow or golfer's elbow as well. And you also see it a fair amount in industrial settings, like at factories, car factories or what have you, where you're doing repetitive work as well. And I mentioned that Finkelstein's test a little bit earlier. So again, the location is around the wrist. Pain can radiate through the forearm or into the thumb area. So all along that area is where you'll find discomfort with this condition. It's oftentimes referred to as constant aching or burning pain, and it's aggravated with any gripping, lifting, twisting motions of the wrist and the hand. Okay, let's get on to arthritis, because this is probably one of the most common things that we use the system for. Most commonly, osteoarthritis that usually occurs around the thumb, but also can occur around the distal or the the small finger joints close to the nail. And of course, we have rheumatoid arthritis. Location is a little bit different. And rarely we have psoriatic arthritis. Sometimes you'll see patches of psoriasis with it, and gouty arthritis as well. Location-wise, osteoarthritis is more common, as I mentioned, the distal interphalangeal joints. You can see the blue specks. I'm going to try not to move my mouse. I don't know what the issue is there. I got to figure that out, guys. I've never had comments like that before as far as those black boxes, so it's a weird one. Okay, so distal interphalangeal joints is usually OA. Then the next one up, what are referred to as the proximal interphalangeal joints, you will see OA, but also you'll see rheumatoid arthritis. And the knuckle joints, those are called the metacarpal phalangeal joints. That's most common in rheumatoid arthritis. So if you're getting pain or issues around the knuckle joints, usually that's a sign of RA, and again, a sign that you should get tested. And then, of course, the most common spot for osteoarthritis is around the thumb joint, because that's where we use a lot of our, so it's overuse injury or disease. And of course, the thumb is what we use the most. Things associated with arthritis is it affects the bone. You can sometimes even get microfractures. You might get swelling. You'll get a synovitis or irritation of the synovial lining around the joints, and you'll get swelling inside the joint. That's called interarticular effusion. All of these different structures can cause pain and discomfort due to osteoarthritis. So it's a syndrome. So usually you have pain, you have functional limitations like gripping strength, those kinds of things, range of motion. And of course, ultimately will reduce your quality of life. So lots of tissues involved, as I mentioned earlier, from the cartilage and bone to the joint capsule to even muscles and ligaments. So when you're treating it, you need to make sure that you're treating it properly. You need to do strengthening exercises, stretching exercises. You need to work on range of motion and reduce the inflammation. So all these things should be done when you have arthritis. It's a fairly prevalent and common condition. Up to 10% have symptomatic OA. It's probably higher than that now. And it's predicted, see how old this is? They don't do updates that often. Fourth leading cause of disability worldwide by 2020. So we're in 2021 now. Of course, COVID has taken the headline of late. And 30 to 40% of people with OA can report moderate to severe pain. So it's always something that should be top of mind when you're getting a little bit older, to start treating it even before it's asymptomatic, to reduce the progression, which is something that your personal therapy system can do as well. Rheumatoid arthritis is slightly different. Of course, it's an autoimmune disorder, and I won't go into the details there, but it more commonly affects, as you can see, the knuckle joints. And you can see the swelling, or called the pannus formation, along through there, and the proximal interphalangeal joints, which are the joints just next one distal to the knuckle joints. It's quite extensive how rheumatoid arthritis sort of progresses, but essentially what happens is white blood cells will invade the area because the body is attacking itself. Then you'll get an inflammation that's being triggered. It affects the synovial lining or the joint capsule. This is called synovitis. This can lead to pannus formation, kind of this weird kind of, when you push on the joint, it feels spongy and boggy. That's one of the signs that doctors will look for. And of course, there's blood tests and other work that can be done to verify rheumatoid arthritis. And long-term, you can lead to cartilage and bone degradation. And of course, this leads to more serious problems as well. And associated with all of this, of course, is swelling and edema, or edema. Now, how we're going to treat these conditions is pretty straightforward. Any risk condition like sprains or arthritis, I'd like you to do two placements. One, if your palm is facing towards you, one placement around the wrist area. It should be firmly held in place or strapped into place. That'll be the first position. And the second position, of course, is on the what's referred to as a dorsal side, so the opposite side, and also placed over the carpal bones as well. So generally speaking, for wrist problems, you're going to do these two placements. For carpal tunnel, I'm going to suggest a little different approach. For carpal tunnel, I do want you to use the wrist protocol. I want you to do two placements, however, one directly over the carpal tunnel or the carpal bones, and then a second placement a little distal to that, to covering the hand and the thumb. The reason for that is the median nerve, which is compressed, supplies sensation and muscles, especially over the thumb and the index finger, the second and third fingers. So applying it over that area helps with the nerve that could be inflamed or causing issues as well too. The other placement, which may sound a little unusual, is in the neck. Now, the median nerve originates in the cervical spine or the neck. So we do find it quite beneficial to treat the side of the neck on where you have the carpal tunnel. So if you have it on the right side, I'm going to suggest you treat your right side of your neck using the cervical spine or the neck protocol. If it's on the opposite side, the left side, then treat the left side. If it's bilateral, both sides, then do two placements on the neck. This will help stimulate the nerves that supply the median nerve, excuse me, and can also help to heal a little bit faster. Now, I will say this. This treatment can be quite effective for carpal tunnel syndrome in mild to moderate cases. In moderate to severe cases, when you're dealing with prolonged compression of the nerve, it's a lot more problematic. I'm going to recommend that you seek treatment in a professional healthcare setting because this is where it's quite advanced and you'll get atrophy, muscle weakness, and sometimes quite significant issues with the median nerve. That condition I mentioned earlier, de Quervain's syndrome. Oh, I see that black box now. It's when I highlight, I know what it is now. It's when I highlight a picture that came from the internet or whatever, it goes to that link. So I think that's what the issue is. That's good to know. Okay, so for de Quervain's tendinosynovitis, as I mentioned earlier, it overlies the thumb. So you're going to do two placements, one over the over what's referred to as the excuse me, the radial side or the outside portion of your wrist where your thumb is. So wrap it around that area. And then you'll want to do a second placement directly sort of over the thumb area as well. So basically over those two areas, wrap them around firmly and treat that specific area to affect those tendons that are problematic in this condition using the wrist protocol. Now, when you're treating the hand, it's usually for arthritis or sprains or that kind of issue, you're going to use the hand protocol. There's different ways of approaching this, but what I'm going to recommend for treating the palm side of your hand, depending on the size of your hand, you might need to do two placements. And there I'm going to recommend that you actually place your system so it's face up with the diodes facing up. And you gently place your hand directly on the diodes. They're pretty bright, the red ones are, so keep a small white towel handy just to cover your eyes. It's not going to hurt your eyes, but it can irritate them. So you may need to do two placements like that, one over the palm of the hand and one, then move your fingers a little bit downwards so that the finger joints are on the array as well. And then you can flip your hand to treat the opposite side as well. Or alternatively, you can just place it on top of your hand as well, and maybe place a gentle weight or something to keep pressure on it. I do highly recommend that there's pressure on the skin with the array, because that allows the light to penetrate a little bit deeper. So whether you apply pressure yourself or with a strap or with a light weight, but that will help with the efficacy or the effectiveness of the treatment. Some other treatment tips, because I know we're running out of time here, is that initially, if you have something like an injury or an acute scenario, try and treat 4, 5, 6 days in a row. One time a day is usually suffice. You don't have to treat more than once a day, but consecutive days when something's really inflamed is usually quite beneficial. And then thereafter, treat 3, 4 times a week. So maybe every other day. Occasionally, you can do consecutive days. And as it's progressing and you're feeling a lot better, then you can go down to once or twice a week. Now, if you have a progressive disorder, usually like arthritis, you're going to want to maintain and treat maybe once a week, maybe sometimes twice a week, depending on how you're feeling, but don't just put it away and don't treat it again until you start to feel the symptoms of it again, because it's a progressive disorder. If it's a finger sprain or an injury, then once you're healed, you're fine. However, if it's something that is progressive, like arthritis, then you'll need to treat it on an ongoing or maintenance basis. And you have to figure out sort of what works best for you there. So always start with stage one. Don't skip stages. Start with stage one and apply at least 4 to 8 sessions in general. If you're feeling pretty good and it's really helping, then keep at that stage. If you're finding it's not being overly helpful, or it was helpful and now it's sort of plateauing, then you can jump to stage 2. And again, another 4 to 8 sessions in general before going to the next stage. Okay, so always give it a chance to work before you, if you have a clinical plateau, and then you can sort of jump those stages. And by the way, sometimes you can actually even go back stages as well. If you're the top 3, let's say at your stage number 4, and it seems to be plateauing again, then maybe jump back down to stage 2 or even stage 1. Sometimes mixing it around prevents what's referred to as accommodation of the cells and the tissues to the light as well. Generally speaking, if you're doing maintenance treatment, like ongoing treatment just to keep it at bay, then use stage 1 or stage 2. Okay, so that's the end of today's webinar. Before I let you go and get to the questions, I do want to mention that about that masterclass. Just go to our website, bioflexlaser.com, under events, and you'll see that site there. The headline speaker, as I mentioned, is Ashley Banjan, a neurologist. We also have one of the world's leading experts in dental applications for TMJ, or temporomandibular joint disorder, Dr. Jan Tuner out of Sweden, and along with a host of other really fascinating speakers. So hopefully you can join us for us that day. I have training coming up. We have one coming up in June, since the main one's already passed. In July, and you can register for our events as well. And I have a next free webinar on hip and shoulder labral tears, which is a cartilage that surrounds these joints. This one's a professional topic webinar, but again, anyone's free to join in for that specific one as well too.